Hi, I'm Sammy. I was rotating in Iquitos, Peru. I'm going into emergency medicine, but I spent 1 week on infectious diseases and then the rest of the time in pediatrics. The hospital was the regional hospital of Loreto in Iquitos. Some of the unique features of training at HRL, I would say, first and foremost, the physicians are just absolutely amazing. I think they are pretty under-resourced in terms of what labs and exams they can get. So I honestly felt like that made them a lot better physicians, just what they do with physical exam and history taking. They just kind of have to use their minds and hands in different ways. So I felt like that was pretty unique. There were a lot of instances when we had our lecture series, a whole week dedicated to dengue fever, where they talked a lot about social circumstance and things affecting patients when trying to decide their treatment plans and the critical importance it was to take those things into account, deciding maybe who can go home and who you're going to keep at the hospital, not just based on how severe they are right now, but really thinking about how feasible is it going to be for them to come back, because we also saw a lot of patients, and it's just kind of the reality of it, but a lot of the patients that live along the river, more outside of the city, it's just really hard for them to get to the hospital. It's by boat, and sometimes it takes multiple days. So there would be, kids with really bad snake bites that took them a couple days to come in, and there's things like that you can't really help. They're emergencies and accidents. So when we do have some control, they really harped on the importance of taking that into account. There were multiple patient cases that really stood out and helped me kind of think about medicine in a different way and give me things that I know I'm going to take with me. And one of the things I'm thinking about in particular is a patient who was in his 70s or 80s, had leprosy most of his life, that was untreated most of his life. So he had all these sequelae of it, his hands were really flexed, and he talked about how he had leprosy, diagnosed when he was 13, but he lived in the rainforest area along the river, and just couldn't get back to the hospital to get his medications. So the treatment plan for him just kind of wasn't realistic, and he needed a lot more resources to be able to get treated. So he didn't end up being treated till he was 60. So just kind of there's a lot of emphasis on social medicine there, and just kind of seeing how that plays out and really how that needs to be taken into account. And they do a really good job of that there. So I'll definitely take that with me. The illnesses you see there, especially the tropical medicine, a lot of malaria and dengue and advanced TB and things that you really don't see here. And I think that was a really unique experience. And I'm going to emergency medicine, so it was helpful for me, and I think it would be helpful for any specialty because there's some of everything. I just want to thank the Global Health Program at DGSOM, and our host family and everyone that helped make this happen.